Welcome to the Maternal Health Innovation Podcast Season 4. I am your host, Venus Standard, Assistant Professor at UNC School of Medicine at Chapel Hill, North Carolina, a certified nurse midwife, the Director of Health Equity Education and Community Engagement for the UNC Department of Family Medicine, and the co-founder and director of the Lead Doula program in Chapel Hill. On Maternal Health Innovation Podcast, we elevate the voices of health innovators and learn ways to implement and mitigate the current maternal health crisis in the United States. Be sure to subscribe so you can get notifications of our upcoming shows. This episode is titled The Mourning After, Reclaiming Our Joy. I'm talking with Zay Bell, Executive Director, Creator, and Founder of Zeal of Xander, a nonprofit whose mission is to engage Black parents, institutions that provide health services, and legislation to invoke the advancement of pregnancy outcomes for Black women and their infants. After the loss of her son Xander, Zay became passionate advocate for maternal health. She is the creator and founder of two impactful nonprofits, Zeal of Xander, Inc., and the Black Birth Institute, based in Jacksonville, Florida. Zay is dedicated to addressing the unique needs and challenges faced by Black women and their families in her community. She holds a master's degree and has completed specialized trainings in perinatal mood and anxiety disorder. In addition to her full spectrum and community-based doula certifications, Zay is also a certified health equity trainer, lactation educator, and brings awareness to the intergenerational trauma associated with breastfeeding in the Black community. She also holds certifications as a life and goal-setting coach. This combination of skills enables her to provide holistic support, addressing not only the physical aspects of maternal health, but also the emotional and mental well-being of her clients. Good morning, and thank you, Zay, for joining us.
Good morning. I'm happy to be here.
We're going to start with a few questions. I think your life story is very impactful, and I'm going to ask a few questions in regards to how you got to where you are, if that's okay with you.
That is perfect.
Zeal of Xander was created after your own painful maternal health experience. How did the mourning period after your loss of your son shape your understanding of grief and the impacts on your daily life?
That's a good question. I think for me, of course, growing up in the South, we're very communal. I'm an Alabamian. And so the loss experience is certainly different because we embrace, of course, the memories. We do the repast, we get together, we do all of those things. And then what I recognize is that we did all of those things and then everything went back to normal. And when I was mourning my own son, even though I had lost grandparents and cousins and uncles and and aunts and things of that nature, when I was grieving my own son, what I recognized is normal did not exist. I was searching for this sense of I want to be who I was before this. And then I recognized in the whole process that my old self had died with my son. And so that really kind of threw me into recognizing that mourning is not a snapshot. It's not something that you do immediately after. It's a lifestyle that you have to navigate through. And we're really not given the skill set to do that, specifically in the Black community. And unfortunately, statistically, Black people die more often. So we have more experience in death, right? We know what it looks like to have, by midlife, to have a parent, a sibling, and a child to die. So for me, recognizing that what textbooks say grief looks like when it comes to the denial piece, that does not apply to the Black community. We are not in denial first. We are in despair. And then what they really do not discuss in the grief process is that we go into survival mode. We go to what we know best, and what we know best is to function in dysfunction. So for me, losing my son gave me the awareness to know that parents are not supposed to bury their kids. We are not prepared to bury our children. No one gives you a handbook on how to navigate through that space of grief, despair, survival, and also in our culture, the adoption of the fact that death is so normal that we say death comes in threes. So we anticipate the compounded grief associated with that, right? So we just, one person dies, we're waiting for two more people. We're just absolutely just waiting for it. And I had to understand that in itself wasn't normal either. But we had adopted it as our birthright. So for me, it was like a blooming onion. It opened up so many different layers of the fact that we had placed boundaries around what grief looked like for us, because in our culture, we had to be stoic. You are so strong. Your son would be proud of you because you didn't break down and cry and scream and do all of these things. And mourning has taught me that there is no golden star, no cookie. There is no certificate or award, that you can be broken in your grieving and mourning process because it's something to feel bad about.
Mm-hmm. Absolutely. And first off, I am sorry for the loss of your son and the journey that you've had to take because of this. So how does the sustainability goals of your organization align with providing cultural congruent care to your Black community?
I think that when we look at, and the sustainability, comes, that word comes up a lot when we talk about funding, right? When we talk about what's going to happen after the funding dries up in certain communities. What I recognize is that we have a lot of people in our community that have lived experience. And so the sustainability piece for us looks like, can we teach them something that will make them champions in their area, right? So what I knew is that Black women were losing children more often, that we were going through that process, and there is no way that we could go through that process and not learn something or not safeguard ourselves right through the process. So I wanted to make sure that I educated women on how to survive the loss of a child. I wanted to make sure that I included their fathers as well, because we never include dads in the grieving process. And I wanted them to take ownership of the fact that they are in a position that unfortunately will continue to happen, because we know that Black women lose babies more often than our white counterparts. But no one was giving us direction on that. I did not know. I have a master's degree. I was a person that has a master's degree, an individual that had a nice income, but I did not know that this was a thing. Like, we're taught, hey, as a Black woman, you go to school, you obtain your degree, you vote, don't get into any trouble, you do all of those things, but nobody tells us how to navigate being pregnant and Black simultaneously. And so I think that the first thing for me when it came to forming the organization was not only to keep me alive during the process, because I needed something to live for after that, but also to educate the community, because not only will we have individuals that will lose children that are Black, but I was looking at my own mother that was in her 70s that had lost 5 children before me.
Oh, wow.
And she had not been able to navigate through that, because for her, the loss was not significant because it was not similar to my loss, even though she had lost 5. And so I wanted to, I always say that I'm the permission slip signer. I wanted to come into the community to sign the permission slip of Black women and let them know that it's okay to grieve that you lost a pregnancy at 8 weeks, 10 weeks, 16 weeks, 19 weeks. A loss is a loss is a loss. And then to educate them on how to be safe when you go into a institution, specifically a medical institution that was not designed to protect you. Mm-hmm. So those are the things when it comes to sustainability, is we have to educate the individuals that are impacted. Bringing initiatives in is great. Having programs is wonderful. But what happens when funding dries up? So we have to put people in the community that with the skill set to protect themselves, to advocate for themselves. And so that's what, my goal was initially starting.
Wonderful. Thank you. So how did the experience of not receiving culturally competent care, particularly during the postpartum after your loss, drive you to create the book, The Mourning After, the Black Infant Mortality Anthology?
This is such a multi-dimensional question, because I look at all the experiences that I went through, and I did not think at the time that it had, I don't know why I didn't think at the time that it had anything to do with race. And that could just be the shock value of it, and that I was in such shock that this was happening. So, and as someone from the South, my mom always tells us, and my parents used to tell us, you don't go to somebody's job and teach them how to do it. Don't go to people's job and tell them how to do it. So in my head, I was being advised of, even though I didn't agree, maybe this was medically sound information, right? Maybe they were providing me with medically sound information. So, and every single year I go through that process. And so the process really started on the wrong foot when I remember walking into my appointment, and I was a first-time patient, walked into the appointment, and I remember the young lady, she was a white nurse or she was a registration agent. And instead of asking me, hey, how are you doing? Welcoming me in, she asked immediately, so you're going to be using Medicaid today, right? And I was so taken aback. I said, well, what is it about me that makes you think that I'm using Medicaid today? And she's like, no, I just thought that you were going to use it. So I kind of let that slide. And I had, went to some other appointments later, and I was explaining to them, like, I feel my son low in my cervix. I just feel him very low. And they were like, well, you don't have an infection. You're fine. Your baby's measuring small. So what we're going to do is we're going to change your original due date by 10 days. And in my head, I'm thinking, well, I mean, he's going to come when he gets ready. Like, he's just going to come. So I'm not going to fight that. You're the professional, And I went through the most hectic several weeks of my life being in preterm labor, and them telling me that I was just constipated. And when I went for an anatomy scan, they sent me to UNC Chapel Hill. And by the time I got there, I was 2 centimeters dilated. They could not do the cerclage. And I was immediately given condolences, even though my son's heartbeat was still there. 153 beats a minute. I remember that number for the rest of my life. And they told me, we can't save your son because he needs 8 days more of gestation. And I immediately thought, you just took 10 days. Just give him his 10 days back. Give him his 10 days back. And they would not. And so I asked for every doctor that would touch my son to come into my room and explain to me, why can't you save my son? And all of them, went back to, hey, you need 8 more days of gestation. He's not viable. And I remember the only female in that room was a white nurse practitioner. And she told me, I know that you want to be a mom, but this is not the way to do it. So I say all of those things to say, when it comes to the cultural congruency piece, is if my provider had been aware that Black women have smaller babies due to weathering, that whole, hey, your baby is small, wouldn't have been an issue. And the due date would have remained the same. right? Because their concern was, oh, he's measuring a week, almost a week and a half smaller, so we have to amend this date. So that is the thing. The other thing is what bedside manner looks like when you are talking to a Black patient. Is we care very much so about presentation and the experience that you provide us with, right? And so that was a really big component for me, even throughout the process, even knowing what we do historically. When it comes to postpartum, that piece, that 6-week piece, staying in the house, don't take a bath, doing all of those things. And I remember having him at 10:52, and about 1 or 2 o'clock, they came and told me, you can leave if you want to, you don't have to stay here. And my mother was flabbergasted. So all of those things stacking up, knowing that I couldn't identify out of 20 people that I would touch in that hospital that were on my birth team, only 3 of them were Black. And so I was searching for those individuals. But what we also know is in that field in obstetrics and gynecology, we know that the representation of when it comes to Black faces and the likelihood that you would get someone that's Black that's an OB is very, very rare. And so I think that even with you, because you are a midwife, I just want to know, do you think that it is significant and it's important to have Black representation in obstetrics and gynecology?
It's critically important. It really is. You have several reasons why it's important. There's cultural competency and understanding, like through the lived experience. There's inherited trust. We get the trust card by default. There's an understanding and addressing health disparities as well, fostering empowerment, advocacy, and we create a safe space. Now, if we look back at the beginning, in the beginning of the 20th centuries, Black midwives were the primary obstetrical providers in their community. They birthed all the babies in their area because they were not allowed to go to the hospital. Then, right about late 1800s, the white physicians and the public health nurses did away with traditional midwifery. And that's where I think the racial disparity and the maternal mortality really began. Fast forward to today, like you just said, there's less than 6% of all physicians that are Black.
Yeah.
Only about 5 to 7% of midwives are Black, less than 10% of nurses.
Yes.
And we guesstimate about 10% of all doulas are Black. So it's really not uncommon that your entire, like you experienced 3 out of 10, your entire care team is white.
Yeah.
Now we endure historical trauma, obstetrical racism, and perinatal mistreatment all this time. And that all influences the perinatal outcome and shapes the experience of the Black woman and other birthing people. Cultural concordance is essential. It really is. So it's unfortunate. We have to ask the question, do Black people, birthing people, want a Black healthcare provider?
Yes.
Is that a thing? Does that make you feel better? With cultural concordant care, there's the inherent level of respect and trust and possibly understanding. So I do agree that you have better birth outcomes and an overall better birth experience. For sure. Jay, I'd just like to ask, in what ways does the concept of medical apartheid still influence the quality of care Black women and Black birthing people receive today?
I think that is a multidimensional question. And the reason that I say that is because it's on so many levels as well. Anything that has to do with the cultural congruent piece is so historically embedded in us, right? And so I think that we were given a download in our DNA as to what it looks like to go into a doctor's office, right? I remember as a child not having any Black providers except one nurse that was my nurse as a child, was my sister's nurse, was my sister's children's nurse. So she has touched 3 generations of us. and she still stays around. But I remember being very protected when I was with her. Like I really felt like this lady was my auntie, and I didn't know why I felt that way. But I also have watched, through generations, what it looks like to go into a doctor's office and to not something that was just off, right? And so it really assisted in building that distrust. And so when I lost my son, what I knew is that I had to build a team that looked like me, because I felt better when Black women were around, because there was something that I did not have to explain to them. And I did not have to explain the distress. I remember the nurse that caught my son at UNC, and she looked at my son, and she looked at me, and she looked at the doctor, and she said, "Wow, he's larger than I expected. Do you want us to call the NICU?" And he said no. And I utilized that example because for me, she saw hope in that. She said, "Wow, he doesn't look anything like we thought. So let's try to do something." And then instantaneously, that hope was crumbled with his no. And so for us, apartheid looks like the no. It looks like I came in here with hopes that you would choose better in how you treat me, and you still decided to choose your no. So there has always been a distrust when it comes to, we know what the syphilis experiment looks like. We know what those things look like. We know what the what do we call it? The Mississippi appendectomies look like, where women were sterilized without permission. We know what that looks like. And so my focus then turned to, if you do not care about my Black son, and you can say no so easily without providing intervention, when this lady that is a medical professional as well has told you, "Wow, we may need to seek the NICU in this situation," what are you going to say about me? And so the quality of care is definitely embedded in white antics. And what that looks like is that we are still very much so looking through a J. Marion Sims lens, right? That Black people have thicker skin, right? That Black patients have a higher threshold for pain. And I think that also translates to, because Black people lose children more often, even though even their hearts don't break the same. Yes. So that's what that really looks like for, when it comes to the medical apartheid piece. And also, as a doula, I'm a full spectrum doula as well, but as a doula, just helping women advocate for themselves in that space, and having a voice. And so, because you're in that space all the time, like, do you see that Black women are creating their own narratives in the birth space? Like, how do you see that we're shifting that whole apartheid piece?
Yes. For sure. It's increasing. There's still a whole lot of education to do, but they're starting to create their own narratives in the birthing space, reshaping how maternal health is approached and their experience within their community. Historically, like you said, the birth space in the U.S. has been predominant by the narratives of excluding and marginalizing the experiences of Black women and Black birthing people. However, in the recent years, there has been a significant shift in Black women taking more control over their birth experience, advocating for themselves, and building, like you mentioned, building their network around them of people that look like them. This movement is should have been here a long time ago, but it includes a resurgence of Black midwives and doulas who are reclaiming the traditional practices, centering cultural relevant care, and by addressing specific needs of Black mothers and birthing people. Organizations like Black Mamas Matter and birth equity advocacy projects, along with numerous other local initiatives, are at the forefront of this change, working to address disparities and promote maternal health equity. With the rise of social media and the digital platforms that we are seeing now, it has empowered Black women to share their stories, raise awareness, and just overtake the systemic issue in maternal health care right now that we're seeing in our communities.
I think that's encouraging, because I know that you also said something about advocacy. And so with me, instinctively, I just really wanted to advocate for myself. And I wanted to make sure that people knew that, listen, there has to be, you have to explain to me why you can't save my son, right? And I'm asking all of these people, why can't you save him? Why can't you save him? Why can't you save him? And my mom is looking at me like, why do you have all these people in here? Like, everybody is saying the same thing. And I just kept getting no after no after no. And I was really craving a yes. But what I did do is I created the environment of, you just can't tell me anything and think that I'm going to accept that.
That's right. That's right.
And so as a doula, one of the things that I really push is advocacy. And, you know, women being able to even change their providers in the midst of that, if they don't feel safe. Like, what do you think, like, for someone that is pregnant, like, what do you think is the best way for them to do that if they don't feel safe when it comes to that advocacy piece?
I mean, you have to first listen to your instincts. If you don't feel safe, you don't feel supported, you need to have a team around you that does. This completely shifts everything. Your right to quality, your right to respectful care, and to have the important providers that listen to you and listen to your concerns. So people can, again, first trust your instincts, research the identity and research and identify new providers in your area. Yeah. Communicate with your current provider. You're not listening to me. You're not listening to me. I'm saying this, and you're not listening to me. Seek the support of a doula, because that's what doulas do, right? They help. And document everything. The problem is when, especially when you're in the South, and some things, there's nuances that overshadow that. If you live in a small little town, sometimes you have limited options.
Yeah.
You know, if you live in a town that only has one hospital and maybe one or two OB groups, so your options are limited. So there's sometimes, not all the time, but sometimes within a group, the group has the same kind of practice style. So you switch to somebody else in the practice, you're getting really the same thing.
Yeah.
So you got to hope that the other practice in your town not only is different or has providers that are different, but they accept your insurance, because not all providers accept all insurances. Right. Yeah. And we've seen that over and over again, especially when it comes to Medicaid or lower paying private insurances. Some providers will not accept it. So then you kind of feel stuck. You kind of feel that you have no choice but to endure this trauma that we're getting. And it's unfortunate that you do that. People feel that way. They feel stuck, but they don't have to endure the mistrust and the trauma. They can go someplace else. But then the other added piece is, do you have the ability to go outside of your community?
Yes.
Do you have travel ability? Do you suffer from the inability to travel freely? So that is also a problem that we must look at, all the new little nuances that shape. So if you feel stuck and you stay in place, the providers do not have an incentive to change. Just don't, because you feel trapped. They feel that they got you trapped, and things just continue. But yes, we should absolutely be encouraging. We should absolutely be educating people, women and birthing people, to know you do not have to accept this. Hands down, no other questions.
Yeah, that's great.
So how does the legacy of Ida B. Wells influence your work and advocacy, particularly in the context of Black maternal health and grief?
I love Ida B. Wells. I really feel like if I was born in the 1800s, she would have been my best friend. I just, hands down, believe that. You know, Ida was, and I call her Ida like me and her really know each other. Like, let's be clear. This lady is my friend. This is my auntie at this point. You know, she was born and raised like 5 hours from where I live. And I wish that I had known about her or had experienced her story when I was younger. But it took this work for me to really understand who she is. And so the comparison and the likeness that we have. She's a writer. I'm a writer. She was an investigator. I'm an investigator. She is a dangerous Negro agitator. According to the FBI, I am the same thing. She was a crusader. I am that. And she was just innovative, just did things like way before her time, and was very passionate about things. And when we think about the NAACP, we know that she was a co-founder of that. And she was not afraid to put things on paper. And that's what the morning after was for me. I was not afraid to put things on paper. And so when we think about being a trendsetter, this woman was an educator, lost both of her parents and siblings to yellow fever, was the matriarch of her family, moved some of her siblings because she was their primary caregiver to Tennessee. But she also did something that was very brave. She had audacity, right? She had audacity to discuss lynchings in the South and the myths associated to why it was appropriate. So when it comes to the context of Black maternal health and grief, when it comes to Ida B. Wells, I think the context simply is the relation between what she was doing in exposing lynching. And what we have to understand is infant mortality, Black women dying while having a child, our Black babies dying is our modern day form of lynching.
Yes. Yes.
And so we have a great deal. I'm so thankful for the Black maternal health space. And I am thankful that a lot of individuals that are working in this space do not have the experience of the implicit bias piece, does not have the experience of dying, does not have the experience of watching their children die. I think I did that for everybody. I don't want people to have to experience what lynching looks like in Black maternal health. So, we are considered the unicorns of the field. We are the individuals that have lived experience. We educate ourselves, and then we go and we're very action based. And so we expose lynching, and my superpower is that I'm eloquent with words and I can put it down on paper, and that I have the same arrogance and audacity that she had, that I can stand up flat-footed and strong and say, we are still dying, but it's not by way of tree. It's by way of institution and systems that were not created for us. The same way that you put in books about the relation to Black people and medicine and the standard of care, it's the same way that we're going to put in books that you're killing us.
Yes. Absolutely.
And so I think that is the gift that she gave me.
Wonderful.
Yeah.
That was awesome. Thank you. Can you elaborate a little bit on the metaphor of everything I love is in a box? How does that relate to your personal loss?
So when I lost my son, they have a grief box. At the time, they had a grief box. And it had a sticker on the top, but the box was a pastry box. So it was similar to a box that you would get from, if you go and order a sheet cake from Walmart, it was similar to that. So it was white and it had a sticker on the top of it. So my best friend and I were leaving UNC. And so we made it to the parking lot and I just could not find my car. I just could not locate it. And I had been there for a couple of days, and I was walking around and my best friend had this big cake box, right? And so I stopped the parking lot attendant and I said, hey,
Stop.
do you guys tow cars here? And she was like, no. I was like, I cannot find my car. And so she was like, oh no, we don't tow cars. So she said, well, maybe just, do your alarm. So maybe your alarm could go off and you can find it. I said, okay. I said, that's a great idea. And then she said, hey, can I have a piece of your cake? And I said, what are you talking about? And so my best friend, I looked at me and she was just like, no, please. Like, she was like bargaining with me, like, please do not snap at this point, because you have held it together. Like, girl, like, all we have to do is just get to this car. You have held it together. And I was looking at her like, I don't understand. Explain to me. I said, what is she talking about? And so she looked down at the box. And then I said, oh. So I turned to her and I said, I said, this isn't celebratory. I said, I came into this hospital with a baby and all I have is a box full of things that I will never be able to use. And she said, oh, I'm so sorry. She apologized. And so we got in the car. I put the cake box in the car, got in the car, drove through the parking lot, the gatekeeper, and I gave her my ticket, and she looked at me and she said, she was looking like through the car, like the box, me, my best friend. And she said, wow, you've been here a long time. You must be really sick. Are you sick? And I said, no, I lost my baby. And now they gave me a box full of stuff that I'll never be able to use. And she was like, oh my God, I'm so sorry. So I get home, and at this point I had planned, like, when my parents leave after my son's memorial service, after his dad leaves, they are going to leave like on a Monday. Tuesday, I am going to end my life. Wednesday, the housekeeper will come, and Thursday, my parents will make arrangements for my body to be shipped. And then I started thinking, like, how unfair would it be if my parents had to transport my son's body in the car with my best friend. My father dug his grave. My sister sung at his service. I was not there when my son was buried. I was still in North Carolina. And when they call my mom, she's going to have to tell my dad. And my dad is going to have to tell my sisters. And they're going to have to tell my best friend. What can I do? And then I was thinking, I have dogs. Like, who's going to take care of my dogs in the meantime, right? And so I'm just going through all of these things. And then 2 months later, my 10-year-old Shih Tzu dies. And I begged him not to die. I was like, Bailey, I cannot. I was like, you just have to hold on. Xander passed in April. He was diagnosed with the oral melanoma in May. Died the first week, July 5th, right after my son. And I remember saying, I cannot put my dog down. Like, I cannot do that. He has been with me for 10 years. I was bargaining with God. Do not make me do this. Like, don't make me do it. And I remember taking my dog to the vet. They gave him a shot to make him drowsy, and he passed away in my lap. And I remember everybody crying. The vet tech, my vet was crying. I'm crying, and the only thing that I could say was, Xander has a puppy today. Like, that was the only thing that brought me peace. And I got home, and the process went through, and they told me to come and pick up my, I had my dog cremated. So they were like, come and pick up his remains. And I'm sitting there thinking, I have a baby that's buried in Alabama. And I have a dog that's been with me through 10 years that went through the pregnancy with me and went through the loss and woke up, and when I cried in the middle of the night to tend to me, and everything that I love is in the box. What am I supposed to do with that? What am I supposed to do with that? And I think for us, being in the Black community, specifically being in Southern states, we're not navigated to outside resources like therapists and perinatal mental health certified individuals. We are navigated to God first. What I also knew was that I was very upset with God, and I did not want to have a conversation with him. I didn't want to have a conversation with God, with Jesus, the Holy Ghost. None of y'all did not want to have a conversation with you, because what you told me growing up, it was instilled in me that you knew the plans that you had for me before I was formed in my mother's womb, if you knew those plans, you knew that I would not like this. Why would you take me through it? And so my mom navigated me to prayer, and I told her I did not want to talk to God. She could do that for me, but I need to go and talk to somebody else. And but also what I noticed is that there was not really a lot of Black individuals that I could have conversations with, and that could help me through that cultural piece of identifying that just because I wanted to go to a therapist didn't mean that I loved God any less. And so I think even for you, because that was my one experience with loss, which was a significant loss, but you may deal with women that are Black that will, and you will experience multiple losses as a Black midwife. And so how do you support your Black patients when they are going through a loss?
You walk a fine line. You really do, because it involves a deeper understanding of unique things. They may be unique cultures, emotional and systemic changes and challenges that they're facing. We have to create a safe and compassionate space. We have to be able to listen, allow them to share their experience, feelings, fears without interruption or judgment. We have to offer cultural sensitive care. There may be things within their family tradition that they do that we don't understand or used to. We have to allow space for that, for them to respect and honor their traditions, even if we don't understand it. We have to give emotional space. Sometimes, and I've heard this, it wasn't about what I say or did, it was just about being there in the space. I remember it was right around 9/11. I was in New York City. It was around 9/11. And for whatever the reason, there was a lot of babies that died. And we did a grief counseling session for the doulas. And it was like, you say 5 words, I'm sorry for your loss. And then you say nothing else because there's nothing else to say. Just be there in that space. Give them the space that they need to know that you're sitting there. So sometimes that's just what I do. I'm just there. I may hug, I may cry with them, but they just know that I'm there.
Yeah.
You got to also offer family support, the partner support. People forget about the partner, and the partner has to be that strong person that's there for the birthing person. And they have to almost feel they feel that they have to hide their own feelings of what's going on. And that's by being bottled up. Oftentimes couples that don't have other children split after a loss because their emotions and their griefs were bottled up within them and not going through the loss together. And sometimes just checking in, right? How are you today? I put on my calendar when there's a loss, and I call that person that next year and the next year, or text them. How are you doing today? Not how are you? Are you okay? How are you doing today? Because each day is different. Sometimes there's 1 step up and 2 steps back. Today may not be a good day. So how are you doing today is always my question. We have to offer compassionate, culturally sensitive care and help Black patients navigate the complex emotions and challenges that come with pregnancy loss. They can feel supported in this, because it's a journey. It's a healing journey that you don't get over, you just get through. You have a new normal. Like you said, everything ended that day that you knew, your normal that you knew had gone. So now you have to navigate this new normal. So it's a challenge sometimes. Yeah, for sure. Can you discuss the importance of Black grief within the kitchen and how it approaches and aids in the healing?
So I do a training called Black Grief, and I definitely tell providers like doulas in the space, individuals that will go in to assist and help women through their grief navigate through their grief process, after losing a child. And so one thing that I tell them is you can't always depend on the Edinburgh to be correct, right? Because we recognize that is a screening and scoring system that did not take the Black culture into consideration.
That's right.
Okay. So the tool that I give them is observing from the kitchen. And so I advise individuals, if you want to know if a Black woman is functioning low or high, you go to her kitchen. And the reason that you go to her kitchen is because you can tell what is going on from her kitchen. So you can tell whether or not there is electricity in the house. You may go in the house and all the lights may be off, but if you go in the kitchen, historically in a Black house, you do not turn off the hood light. Only a Black person would know that.
That's
the
right.
light on the hood over the stove doesn't hurt. We don't turn it off. Okay. We do not know why we don't do it, but we know that in most households, specifically when you go to those marginalized communities, what they would consider low income communities, that would be consistent to leave this light on, period. Like it never goes off, right? And if that is not the case, then the refrigerator is always humming. So you can tell whether they have electricity, right? You can tell if they have running water from their sink. And you can be creative, say, oh, can I wash my hands really quick or something like that? And then you'll know if they have running water. But also the important piece is Black women are very strategic about how they keep their kitchen. You're not going to see a lot of dishes in the sink. You're not going to see the trash running over. You're not going to experience those things. And if the trash is running over, you're going to be able to use all of your senses. You're going to see if it's running over. You're going to smell how long it's been there, right? And then you're going to know how often have you been eating? Like, when was the last time that you cooked? Do you have leftovers in your refrigerator? What does your pantry look like? Are you providing yourself with the nutrients that you need on a daily basis to be able to function? Do you have water in this place? Are you drinking it? Do you have alcohol in this place? Is that what you're leaning on? And so everything that you need to know about the mental health and the function of a Black woman happens in her kitchen. She's not going to let her dishes be dirty. She's not going to let them be piled up. She's not going to let trash flow over. She's not going to let her stovetop be dirty. She's not going to let her cupboards and her pantry be bare. And then if that is, then there are other questions that you need to ask. Do you have a way to provide for your family? What is that? Did you lose your job associated with the fact that you could not go into work because you felt triggered? Do you have the resources, right? Do you have the ability to access, food? How can we help you in that manner? And so everything that you need to know about a Black woman is in her kitchen.
In her kitchen.
In her kitchen.
That is awesome. That's awesome. So what challenges have you faced with professionals in Black maternal health space, particularly when the professional does not share a cultural background?
I've learned two things. And so the first thing is I cannot have an expectation of white providers to know what it looks like to have a Black experience, right? I cannot have the expectation. I did a training because this is Black Breastfeeding Week, and I did a training and I had a white doula and a white IBCLC, and I was not aware that there were individuals that did not know that biracial children were created during slavery. And at first I was like, there's no way that you could not know that. But then I was thinking, that's not your reality either, because you're a white woman. That's not your reality. You don't have to think about that. And so just having the environmental and emotional intelligence to know that when you have a knowledge deficit, that you have to take step backs, not to be agitated, but you have to educate to bring them up, right? And so sometimes that really takes a very far reach back, but it's necessary so that you'll have that information. So one of the challenges is that for the last 6 years, I have had to regulate the atmosphere, because there are individuals that are white that do not have the same information that we have as Black individuals about our Black culture. And I cannot be mad at you because you don't know it. But I also have to regulate the environment to let other Black people know that are agitated that you can't be agitated with them because they didn't know it either. And don't make them feel uncomfortable for exposing that deficit in this space. The other piece is, what we have to recognize is every Black person does not share the same culture. They do not share the same experiences. I learned that when I lived in Pittsburgh. My experience as a Black Southerner from Alabama that had an accent as thick as grits and an essence as sweet as sweet tea, that was not the same as being in Pittsburgh, right? Was definitely not the same. And I also believe that, when you're from the South and you have these experiences and you come on with a thick accent and you walk into these spaces like this, it becomes very entertaining. Like, oh, we love your accent. Oh, we love this. Oh, you're educated, right? I love how you present. And so we go in also trying to prove ourselves that we are educated people. Because we're from the South does not mean that we are slow. So I think for me, the challenge is on the other side, coming in and proving that I am an educated Black person that is also deserving of compensation as well. Because what happens on that side of the space is that sometimes Black women's gifts are prostituted and we are not compensated for our knowledge base, specifically because we are expected to do work just because we are Black. And we're expected to do work that is free, and that is not the case. So I think for me, that those have been the challenges on both sides. Dealing with white providers, dealing with white clients, and also dealing with Black individuals that don't have the same cultural experience that I have as a Southerner.
Right, for sure. So what strategies do you use or you think are necessary to bridge that gap with healthcare providers addressing and leading for Black women, Black people, birthing people?
The strategy that I have specifically is I do town halls. I am a community engagement strategist. So I force people to have tough conversations. And so one of the strategies that, I have for my approach is creating an environment where all of the team players are at the table, right, to have these conversations. What I recognize is that it is just not enough to go into a healthcare plan and have a conversation with them. It is not enough to go into a hospital and have a conversation with them. What we have to do is create a space to bring them into the community because they do not get outside of their normal, comfortable environment. So the strategy is that I need to bring you down to where the demise is happening. And it is happening in this zip code, and it's happening in this space. And I also want you to be in the midst of the doulas, the midwives that are losing these individuals, the women that are dying, their family members, their children. I want you to be in the midst of legislation and what the individuals that are making these policies. I want all of you guys to get together and have to be accountable to each other for what is happening, right? And so what we also have to understand when it comes to strategy, because everybody speaks a different language, I come into a space and I'm interpreting. So I am interpreting to the community, I'm interpreting to the policy makers, I'm interpreting to healthcare, because I've been on all sides of those things, so that we can create a common language that we can understand and we can appreciate, and so that we can move forward. And so I think that it's important to definitely have individual meetings to see what each other are doing, but also to bring these people together so that they can recognize that statistics are just not numbers, they're bodies too. So you have to come down to the community so that you can see what the graveyard looks like. And unfortunately for us, we are the walking dead too, right? We're on a time clock, and somebody that we know is going to die from a pregnancy-related complication that was 100% preventable.
100%, 100%. So you just mentioned like the interpreter. So what does the role of that translation gap play? How does that play in healthcare experience for the Black women, and how can Black women and other birthing people become the solution to that issue?
So the interpreter is a very heavy job, and everybody's not skilled in that. And so I'm only skilled in that because I have worked in different areas. And so for healthcare looks like bottom line, right? So we would look at their HEDIS measures, right? How successful are we? So for me, when you're making decisions when it comes to HEDIS, like one of the things would be considering live birth. If you have a live birth, this is what this looks like. Well, what happens? So the interpreter would say, oh, okay. So this live birth, meaning that you're having a child that's alive. But what happens when you don't? Right? And making them look at that piece, because just because a woman doesn't have a live birth does not mean that she's not in postpartum.
That's right.
So what are you doing for those women, right? What are you doing for Victoria, that's 22 years old, that had a stillbirth because she had a preeclampsia that was ignored by her physician and provider, and she kept telling them that she was experiencing headaches? What do you do for Marquita or Monica that had the same experience, but instead of her child dying, she did? So how are you going to help tend to a child that does not have a mother? So utilizing those scenarios. And so how that closes the gap in that community is letting them know that what you put on paper affects somebody in reality, right? And so they need to really know that. And also, when it comes to the Black community and when it comes to Black women, that this is going to affect is equipping them with an arsenal. Like, we need to get you a pocket guide as to, you can ask these questions. First, let's deal with your confidence. Your confidence, your lived experience and your trauma has qualified you to ask any question that you need to.
For sure.
Right? So you don't have to be afraid to say, hey, I don't feel comfortable with what you just said to me. Can you provide me with a different person in your network? And if you can't, can you put a referral into somebody else? So teaching Black women that you can ask questions, teaching their, you said something that was very significant earlier about their partners, the dads. Teaching the dads on how to safely engage with the provider so that it does not end up with him incarcerated or him tased. That's what translation does. Translation identifies that there is a language gap that we're experiencing because the white culture does not know the passion that the Black culture has that is translated as aggression. We're not being we're not being aggressive. We are just we're in distress. Right? We need what we know is the squeaky wheel gets the oil, it gets the attention. So let me make as much fuss as we can so that I can save my life. And so just being able to even translate that to them, like, hey, they're not violent, they're vulnerable, they're in a space where they are afraid, where they don't think that they're going to make it out of this situation. How can we get them help? How can they how can you understand? Because we need to take the burden off of the victim and put it on the individual that's right, that has set the environment for them to be unsuccessful in walking out with everybody that walked into that hospital.
Right.
So that the solution is equipping the community with the skill set that they need to identify what implicit bias is, what systemic racism looks like, what institutional racism looks like, what advocacy looks like. The confidence to know that they can say what they need to and ask the questions that they need to, and also the providers to know that when they exhibit these behaviors, it's not aggression. They want to make sure that they are safe.
Absolutely. Zay, we could talk about this all day, but I believe we are probably running out of time. I want to thank you so much for taking the time to join us today and to share your story. And for our audience, I want to thank you for listening. For more podcasts, video, blogs, and maternal health content, please visit us at Maternal Health Learning and Innovation Center's website at maternalhealthlearning.com. I'm Venus Standard, and we'll be talking to you again soon. Thank you very much.